Just published July 2nd, 2025, the American College of Gastroenterology's newest guideline on preventive care in inflammatory bowel disease, also known as IBD. The objective of this guideline is to update the previous American College of Gastroenterology preventive care recommendations for adult patients with inflammatory bowel disease. Health maintenance recommendations addressed in this guideline include the safety and appropriate timing of vaccinations, screening for osteoporosis, cervical cancer, melanoma, and non-melanoma skin cancer, and screening for depression, anxiety, and need for smoking cessation. There are 12 recommendations, so let's get started. In all adult patients with IBD aged 50 and older and no prior pneumococcal vaccination, the guideline suggests pneumococcal vaccination with PCV20 or PCV21. In adult patients with IBD between 19 and 49 years of age, receiving immune-modifying therapy and with no prior pneumococcal vaccination, the guideline suggests pneumococcal vaccination with PCV20 or PCV21. In patients with IBD who have previously received pneumococcal vaccination and are either ages 19 to 64 on immune-modifying therapy or who are age 65 and older, should follow CDC guidance for whether to receive additional pneumococcal vaccination with PCV20 or PCV21. In all adults 50 and older with IBD, the guideline suggests vaccination against herpes zoster, also known as HZ, with the 2-dose inactive recombinant HZ vaccine. In adults 19 and above with IBD on immune-modifying therapy or planning to start therapy, the guideline suggests vaccination against HZ with the 2-dose inactive recombinant HZ vaccine. In adults with IBD, the guideline suggests vaccination against SARS-CoV-2 in accordance with national guidelines. The guideline suggests that a live rotavirus vaccine may be offered in children with in utero exposure to biologic therapy. In women with IBD on immune-modifying therapies, the guideline suggests annual cervical cancer screening within a year of the onset of sexual activity, and if younger than 30 years, should continue for 3 consecutive years before increasing to every 3 years. In patients with IBD, the guideline suggests annual screening for melanoma independent of the use of biologic therapy. In patients with IBD on immune-modifying therapies, the guideline suggests annual screening for NMSC while using these agents, particularly older than the age of 50. In adults with IBD and conventional risk factors for abnormal bone mineral density, the guideline suggests screening for osteoporosis with bone mineral density testing at the time of diagnosis and periodically after diagnosis. In adults with IBD who smoke, the guideline suggests that they should be counseled to quit. And there you have it. Make sure to check out the full guideline from the American College of Gastroenterology and other related clinical decision support tools at guidelinecentral.com.